Hello everyone and welcome back to another Facebook Friday. I wanted to start off by thanking everyone for all the support that they've given us to our videos, and once again really appreciate all the comments that I get in the office and the likes and the shares that we've been getting to this, not just necessarily through Facebook but in other areas that we've posted this content. So I wanted to say thank you for everyone to all the support that they've had. I really appreciate it. But today we've got another great topic for you that Dr. Botros and I had talked about, and that is going to be some of the common myths about back pain that we experience and we hear in the office, and that might be floating around about in the environment. Once again though, I'm Dr. Alan Van Scoyk and I'm joined with Dr. Botros here in the Glendale office of Chiropractic Company. And once again, as chiropractors, we're known as being people that see a lot of back issues and a lot of back pain and conditions. And so we hear a lot of different stories from patients as to, can this do that, or does this really work? And so today we're going to go through a couple of the ones that we've heard and talk to you a little bit about that. So Dr. Botros, tell me a little bit about some of the myths that you've heard.
Well, one common myth I hear a lot is, hey doc, I was doing something the other day and my back started to really hurt. And I know the thing that caused my back pain was me lifting that pencil, or me bending forward to brush my teeth, or me picking up that laundry basket. And the reality is, because we live in a very reactive culture in terms of how we approach our healthcare, we think that A causes B. And so if I have this symptom, or if I have this pain, or I have this discomfort, it must have been caused by a very specific event. And so we become reactive to that. The reality is there are situations where that is the case. And we see that with car accidents, with traumas, with something where there's a direct impact that can really affect your spinal health and nervous system and your musculoskeletal system. But generally speaking, for most people who aren't in those situations, we see that their back pain is actually not caused from that one time they tried to lift their child or their grandchild, or that one time they tried to pick up a dirty item of clothing on the floor, but it's actually a process that's been going on for a long period of time, and that was the metaphorical straw that broke the camel's back, so to speak. And so once people understand that, then they start looking not just at their spinal health from a complete point of view, but every other aspect of health. We see that in dentistry. We don't just live our lives, eat sugar and stay dehydrated and go to bed, and then when we get a toothache we go to a dentist. No, every single day we brush our teeth, we floss, we use Listerine, all that stuff, and then we go to a dentist to get a checkup, and then if we have a problem, then we see what needs to be done with that as well. And so that transition, that myth, unfortunately, lets people be more reactive to their health. They're always waiting for pain or symptoms or discomforts or some kind of disease, and then they start to get treated, whereas we always like and encourage for any domain when it comes to health, be proactive. Try to focus on preventative healthcare. Try to catch things before they show up, or if they show up, early on as opposed to later where it's more solidified.
It's a great myth. Once again, we hear it a lot. And I'm going to touch on this myth again in a couple minutes. But Dr. Botros, any other myths that you hear?
Yeah, I think another really common one is, hey, I don't have back pain, so my spine must actually be pretty healthy. And again, because we associate pain with dysfunction and disease, and not necessarily as a signal. So right now, as we're talking, I'm using my voice as a signal, my hand language as a signal. All of those are signals that could be good or could be translated as bad. And pain is the same way. Pain is not necessarily a bad thing all the time. We see that sometimes pain tells you, hey, you're doing something that needs to be fixed, or hey, there's something here that should be addressed and we have to take care of it. And so we think that if there is no pain, then I must be healthy. The reality is, when I've examined people who, just for a wellness checkup, there are some things that we find, again, early that haven't caused any symptoms. And then we address those things earlier, and that's always a much easier thing to treat and leads to a much better quality of life as well. One common thing most people probably don't know is there are, different stages of degeneration in the spine, spinal alignment and the joints and arthritis and things like that. And the very first one, that transition into the first one, oftentimes can be asymptomatic. And a really good example of this is looking at heart disease. So, when you look at the statistics for heart disease, for example, you see that 50% of people, if they just went on how they felt, they would never really get themselves checked out. And those 50% of the population, their first symptom of a heart disease is an actual full-blown heart attack. And so we don't ever want to wait for those types of situations when it comes to our health in any aspect of our overall health and well-being, but especially our nervous system and our musculoskeletal system as well.
We see that a lot in our office, and we talk with that about patients, is that, once again, pain is not really a good marker for overall health and well-being. And in many circumstances, pain is really the last thing to show up and really one of the first things to go away. Once again, even though you're not having pain, doesn't necessarily mean that the tissue is healthy or doesn't require care to recover. So that's a big point and a big myth that we see in our office quite often. Another one that we get is that children don't ever get chronic back pain. Children are young, they are healthy, they run around, there's no reason that they should have chronic back pain. However, a great study just came out, and is really one of the first major studies on children in back pain in probably about the last 15 years. It was literally just published in August, and it said that of the group of students that they studied, I think it was approximately 5,000, that 33% of them actually had back problems. And out of those 33%, the authors showed that they were going to eventually have a significant amount of them turning into chronic pain. In addition to that, they said that out of the group, once you start moving past those adolescent years, that number increased by 4% for every single year of life. So once again, you look at the school system, a third of those kids are going to have pain. Most of them are going to have chronic pain unless something is done about it. And out of that group, only 20% was significantly getting active treatment for that pain. So once again, there's a large majority of children out there that are starting off their life having problems that'll eventually turn even further faster into larger chronic problems requiring further work. And if we can catch those issues, like Dr. Botros said, prior to them being in pain, prior to them having significant damage, it'll really go a long way for overall wellness down the road. So then another question that we get, and as far as myths are concerned, is that, I have had a lot of back pain. I've now damaged a disc, and once I have a damaged disc, the only thing I can do is have surgery. This is another common myth, and so it is simply not the case. Many times discs are managed conservatively and have fantastic results with, once again, not only feeling better, but functioning better. The reason that I mentioned that specific myth is actually there was a study done in regards to the 7 common myths associated with back pain. And that was one of them, in addition to Dr. Botros' one about having issues with lifting or a specific incident. They took these questions, these 7 common myths, and they went to a med school and said, all right, doctors-to-be, what do you think about these 7 questions? And what do you think? Do you think that they answered them all correctly? Not even close. Unfortunately, the 2 questions that they got most wrong significantly, wasn't one of them was Dr. Botros' question. I think only about 27% of the prospective students actually got that one correct. Now, on the other side, which was actually more surprising to me, but very encouraging, was that last year when the study was done, 2019, they showed that 63% of those students knew that even if you had disc injuries, you were not destined to have spinal surgery, which is fantastic, because this is a big change from how it used to be. Majority of the time, they used to think that, yeah, you have these issues, you're going to have surgery. But now people are realizing, including med students, that, hey, there's other alternatives out there to get treatment and care. Once again, prevention is fantastic. Chiropractic is fantastic. A lot of other physical modalities that can be done for health, wellness, and spinal care. So that's what we have for you today as far as some common myths. If you have questions about any of these surveys and studies, let me know. Contact us at the office. We're here at Chiropractic Company in Glendale. If you have other questions about other topics that we can do for you, once again, we love having them, and we'll be happy to answer them at a later date. We have a couple lined up in regards to some of the previous questions that some people have asked for us, so be looking for that in the future videos. Otherwise, once again, I'm Dr. Adam Van Scoyk, joined with Dr. Botros here for Facebook Friday, and we'll catch you next week.